Hi everyone, welcome and thanks for joining us today for this webinar, Lessons Learned from the COVID-19 Crisis, Moving Towards Inclusive Social Protection for Persons with Disabilities. This webinar follows on from a three-part series, Inclusion of Persons with Disabilities in Social Protection for COVID-19, Recovery and Beyond, that we held in late 2020. The recordings for these last three sessions are up on the socialprotection.org website if you're interested in having a look at them. So to begin with today, I would like to pay my respects to the first Australians, past and present, to the Ngunnawal people on whose traditional lands I am speaking to you from today. These lands were never conceded, and I'd like to thank them for their persistence and patience and sharing their rich and long-standing culture with us. My name is Felicity O'Brien and I work in the Social Protection section in the Australian Department of Foreign Affairs and Trade, and I'll be your moderator for the discussion tonight. So we'll be having live captions and sign language interpretation available for this event. To see the live captions, you can click on the closed captions button at the bottom of your screen. And to pin the interpreter, we do have them on Spotlight, but if you would like to pin them, if you hover over their picture, there's three buttons at the top, and one of those is pin this screen. In the chat function, we'll also have a link so that you can click on the adjustable page of captions if you would like to see them that way too. We're going to be recording the webinar tonight, and that will include the captions and slides, and this will go up on the socialprotection.org website in the following weeks. So this webinar tonight comes to you through a partnership between UNICEF, the International Labour Organization, the United Nations Partnership on the Rights of Persons with Disabilities, the International Disability Alliance, and the Australian Department of Foreign Affairs and Trade. I will be pausing a bit between each guest speaker tonight so that the sign language interpreters can catch up to what we're talking about. We will also have a Q&A session in the middle of the discussion and then one at the end. We encourage you to share your questions to the speakers by using the Q&A option on the menu. You can see that button down on the bottom of your screen as well. And if you wish to make comments or share links to any useful resources, feel free to share them here throughout the discussion today. We have a wonderful panel of speakers for you today, and I'll introduce them in the order that they will be presenting. So first up, we'll have Charles Knox-Vydmanov from the ILO-UNICEF-UNPRPD project. Charles is an independent consultant working on social protection and providing support to the ILO-UNICEF-UNPRPD project on disability, inclusive social protection. Charles has over 12 years of experience in the field, advising governments and other stakeholders on social protection policy, undertaking research and conducting training activities. Our second speaker will be Amber Salelka. She is a Bridge CRPD SDGs officer for the International Disability Alliance. Amber supports the implementation of the Bridge CRPD SDG training initiative and the development of IDA's online learning platform, including work around disability inclusive safeguarding. She is a lawyer by trade, but moved into disability policy advocacy around 2012. She has supported organisations of persons with disabilities from underrepresented groups, including women with disabilities, to participate in policy advocacy, including around social protection. Our third speaker tonight will be Alex Coate from the Disability and Social Protection Policy Specialist at UNICEF. Alex has been working in the field of inclusive development for 25 years across Europe, the Asia Pacific region, and Africa. He actively participated in the negotiation of the Convention of the Rights of Persons with a Disability and has been contributing ever since to both its implementation and monitoring. Through many roles and organisations across the years, he has supported the development of community support services, rehabilitation and assistive technology programs, social policy reforms and humanitarian interventions. He was co-facilitator of the process leading to the joint statement on inclusive social protection systems for the participation of persons with disabilities. We'll make sure that we get that joint statement up on the website tomorrow for you all to see as well. And then lastly, we'll have Quinn Yuen, who is a Social Protection Technical Officer at the International Labour Organization. Quinn is Social Protection Technical Officer in the ILO's Social Protection Department. Prior to her current post, she worked in the ILO Regional Office for Asia and Pacific in Bangkok, holding a master's degree in economics from the University of London. I will now pass over to our first speaker, Charles. Thanks, Charles.
Hello. Good morning, good afternoon, good evening to everyone. Let me just get up the presentation. Great. No, I mean, yeah, just to start by saying it's a real pleasure to be part of the session today. I mean, I think the kind of extent of the number of people who've registered for this event and who are participating today shows the interest in this topic. So it's really good to be able to kind of share some insights on that. And the kind of piece of analysis I'm going to share some information on today has also, I think, been quite an interesting process, and at least for myself, quite an interesting kind of learning experience in terms of the extent to which social protection systems really responded to the needs and situation of persons with disabilities. So just to kind of give a little bit of background in terms of the context for this piece and what I'm going to hopefully quite briefly cover today. So basically what I'm going to present is based on a synthesis paper that we've been undertaking as part of this UNPRPD joint program on disability inclusive response to recovery and planning for COVID-19. And it's also strongly tied to a longer term project that predated COVID-19 that was looking at this question of disability and social protection. So it kind of builds on that foundation. This synthesis itself, I mean, the main kind of data sources that it kind of rests upon are a global database of disability-specific social protection responses that was developed based on other databases, really kind of building on those and expanding, initially in the early kind of stage of the crisis, but it's been updated throughout. But also on this synthesis is based on a number of more detailed country case studies, which are listed here, and I'll refer to in a bit more detail. Those case studies were partly selected to be kind of representative of a range of contexts, but also one kind of, I guess, important caveat is they were selected because in many cases there was something notable or interesting in terms of the countries, in terms of the nature of social protection for persons with disabilities. So on average, these case studies probably represent countries that have done more before and or during the crisis, rather than say low and middle income countries in general. And yeah, low and middle income countries have been the focus of this piece. So yeah, what are the two kind of themes that we're really looking at here? So one question is really looking at the readiness of existing social protection systems and the nature of social protection for persons with disabilities in place before the crisis. And then the second thing is then looking really at the responsiveness of what actually changed or what measures were put in place in relation to those systems. Also, yeah, looking at the impact of COVID on persons with disabilities and the role of those systems, and the two things together. So to start, we wanted to take a step back and really just say, well, what is the function of social protection for persons with disabilities? And this is a quite, I think, potentially quite complex discussion that has many layers, but I wanted to kind of pull out a couple of key points to set the context. So obviously, persons with disabilities face a range of challenges, a range of barriers. But I think when we look at social protection, we can define that it is primarily looking at addressing two different interlinked issues. And the first is that persons with disabilities face greater barriers to earning an income in the labour market, which can be seen as an interaction of the kind of intrinsic capabilities, functionalities, functional limitations, and the environment. But then a second layer is also that persons with disabilities face other disability-related costs, the cost of healthcare, the cost of care and support, the cost of assistive devices, etc. Now, obviously, both of these there's a significant diversity amongst persons with disabilities, and I hope that the importance of that kind of diversity goes without saying, or is kind of recognised in this presentation. So then, how might social protection systems respond to those two core challenges? But I think a kind of key point is, given that we're looking here at the kind of barriers to earning an income, but also these additional costs, I think kind of there's growing recognition of the need for kind of multi-layered systems of social protection benefits, be they cash or in kind. So on one hand, there's a range of different schemes that can be in place to address income security. So the most kind of obvious and specific are disability pensions or allowances. But also there are a range of kind of what are often called mainstream benefits, so family assistance, child benefits, poverty, social assistance, unemployment benefits, old age pensions, which, while not specifically targeted to persons with disabilities, can support their income security across the life cycle. But secondly, there are a range of other kinds of mechanisms, programs, schemes, be they kind of cash or in kind, that can support the coverage of these disability-related extra costs. So on the cash side, that might relate to specific child disability benefits. During kind of working age or old age, it may relate to specific disability support allowances that specifically take account of the additional kind of costs related to disability. It may involve concessions. It may involve services or care, or services or cash benefits supporting persons with disability to access care services. And then a next layer down, which is clearly very important, is access to healthcare, universal health coverage, which, as we know, is very, very of particular relevance to persons with disabilities, given that many face additional health needs and associated costs. And finally, and this is really kind of cross-cutting areas, the kind of recognition that the first three layers need to be linked to other relevant services, not least early childhood development, education, economic empowerment programs, things that, I mean, these are things that I guess, they play a number of roles, but for example, help address some of those barriers to earning an income that you mentioned earlier. So in terms of where things are at a very broad level globally, I think it's well recognized that the coverage of existing social protection benefits, particularly those disability specific ones, is still extremely limited. The ILO estimates, based on kind of 2017 data, that just 1 in 5, 18% of persons with severe disabilities, this is just severe disability, were receiving some kind of disability benefit. And obviously the kind of interaction of these barriers and the weak social protection provision, has led to higher levels of poverty for persons with disability, and higher vulnerability to crisis within the households that they live in. And this kind of picture of the patchiness of social protection is kind of echoed to an extent in the case study countries. So as I mentioned, probably on average, these do better than others. So what this table shows is really whether there are kind of mainstream social assistance programs in place, whether there's any kind of non-contributory disability benefit in place, whether there's a non-contributory old age pension in place. And most countries, actually, not all, those are kind of highlighted in green, most countries have something. In the next slide, I'll talk about the caveat, which is that something and the extent of it varies significantly. And then, however, the kind of second layer, particularly in terms of disability related costs, is much more patchy, even within these countries, which I think you could say are doing relatively better. Specific schemes such as child disability benefits, or that disability benefits cover some of those extra costs, or caregiver benefits or personal assistance is much more limited. And as I said, even where those schemes are in place, they often have significant limitations. So firstly, we could say in relation to the eligibility criteria, or the kind of targeting of disability benefits, commonly they're based on the idea that recipients should be unable to work, with the exceptions of Georgia, Mauritius, and Thailand within the countries we looked at. Many of the schemes are means tested, targeted at the poorest, which creates additional barriers to accessing these schemes, and results, it means that persons with disability are exposed, I guess you could say, to the inherent kind of targeting errors associated with those schemes, the real risk of exclusion. Disability assessment commonly uses a medical model that creates complexity in the application process, and can lead to different forms of exclusion. And then, these kind of mainstream schemes and social assistance schemes are often, while they may in principle be in place for persons with disability, then they're rarely kind of specifically designed to address their needs. There are also issues of inaccessibility, particularly in terms of disability assessment, but also in terms across the kind of delivery chain of these programs, physical barriers to accessing the infrastructure of social protection, information communication, attitudinal. And finally, I mean, today I'm more leaning towards a focus on kind of cash benefits, a bit on the in-kind side. But I think, as is well recognized, there are significant limits in access to healthcare in terms of financial protection, the service coverage and how relevant that is to persons with disability, and also the kind of quality of that and accessibility of health services. Another kind of key, and we're still on the kind of pre-COVID situation here, is that another major issue, drilling down to specific disability benefits, and these are non-contributory schemes, is a significant variation in terms of the adequacy of the benefits. So here on the left-hand side, we've got the benefit levels of a number of the schemes that were among the case study countries. And we've got the benefit levels in PPP dollars, international dollars. And those black kind of lines indicate what is the kind of relevant international poverty line for those countries. So the higher ones are all upper middle income countries, and the lower ones are all lower middle income countries. And you see that while Brazil, Mauritius, and South Africa and Georgia have benefits that are kind of in excess of those international poverty lines, a caveat being that, the meaningfulness and how we interpret them does need some care. But we see some are significantly in excess, but then if we look at Peru and Thailand particularly, those benefits are significantly below. A similar pattern can be seen when comparing to looking at benefits as a share of GDP per capita, so relative to the average income of a country. So that helps us see how adequate are the benefits relative to, say, the level of economic development. And again, we see countries like Brazil, Mauritius, South Africa at the top end, Peru, Thailand, and Sri Lanka much lower. So significant diversity. And this is really just relating to the extent to which these cover, some level of income security. I mean, many fall short of that goal. But the extent to which these schemes cover the disability related extra costs is going to be even lower. So moving to the impact of COVID and the response, which I think is our main interest here. I mean, I imagine many people on this call have been studying these issues in great detail, but I think there's a growing body of evidence illustrating how persons with disability were particularly impacted by the crisis. And looking from this kind of social protection perspective, the kind of income and costs side of thing, we know that persons with disability were particularly impacted by the kind of loss of employment, kind of reduced employment and earnings, either through being those persons with disability that work they're in employment, generally in informal employment, generally more vulnerable to the shock. But even those that may not have been in paid employment, often they live in households that have fewer working members and would be more vulnerable. And this chart from Uzbekistan, which is from one of the case studies, really just shows that the changes in household income from wages and self-employment, there was a more significant fall in households with a person with disability. And also we see evidence that there were increasing costs for persons with disability, be they more kind of general increases such as food, but also medicine, which would have had a particular impact, and things like transport, which was often shut down or had kind of reduced availability. Now, how did countries respond? And this is some data from the database that was compiled, and is really looking at specific kind of social protection, disability-specific social protection measures. So those that specifically referred to a person with disability, be they disability benefits or even with kind of more mainstream cash transfer programs if there was specific reference to persons with disability. And as noted there, it's based on a number of kind of extensive existing databases. And what we find is about overall been identified 98 countries put in place some kind of disability specific measure, which is a bit less than half all countries that put something in place, though a smaller share of the total measures. I mean, a caveat that I'll come back to in a second is just because countries did something doesn't mean it was necessarily adequate or effective. And similarly, even countries that didn't make any adjustment, it may be their social protection system was more protective, if you see what I mean, than those that did something that was more limited. So we shouldn't just look at a measure versus no measures and think one was good and the other was not. As kind of noted here, the most common kind of measure put in place were different kind of cash benefits, adjustments to existing ones on new ones, really then followed by in-kind benefits. Drilling down on those cash benefits, which is where the synthesis paper really leans, we see the most common type was the vertical expansions. That's the top up of existing benefits that were in place. There was a mix between whether they were more short-term or kind of one-off, maybe intended to cover a few months, but as a kind of one-off payment, or longer-term regular payment. So we see most countries, or around half, only had a one-off payment. Others, such as Georgia and South Africa, actually had a regular monthly payment for 6 months. The horizontal expansions, that's increasing the coverage of schemes, was a lot less common, and I'll come back to that. And then the third kind of area, which was also quite common, was the administrative adjustment to schemes. So this included extending the validity of a disability ID, so there wasn't a need to go through a verification process during, say, lockdowns or kind of moments of kind of curfew, or allowing people to apply for such schemes and be enrolled even without the full verification process. Also payment delivery, often doing kind of electronic transfer, door-to-door delivery. Another thing was to advance payments that were due later, to pay them early, I guess, to provide that immediate cash in the time of crisis. So I mentioned vertical expansion, and this, as I say, this has been the more common kind of measure. And we can, to get a sense of how significant that was, we can kind of return to the charts I showed you earlier, which was showing the kind of adequacy of existing benefits across a number of countries. So how significant were the top-ups? Well, compared to what was there beforehand, they weren't necessarily insignificant. If we look at Thailand, the top-up was higher than the original benefit that was in place. The Georgia top-up and the South Africa ones were also not kind of insignificant. And we can show the same thing relative to kind of GDP per capita. So again, looking at the kind of level of economic development of the country. However, I think, again, a key point to make here is in many cases that the top-up provided didn't really compensate fully for the weakness of the pre-existing benefit in terms of adequacy. So we see, for example, Thailand has topped up its benefit there by quite a significant amount, but it still remained only just above the kind of relevant poverty line for that country. And the benefits were significantly below Brazil, Mauritius, South Africa, Georgia. So I guess the point is, intuitively, one would have probably preferred to have been a person with disability receiving a benefit in Brazil and Mauritius, even if it were just the regular benefit, than the topped-up benefit in Thailand in terms of the adequacy one was receiving. Another thing is also to mention, this is only cash benefits. Even some of those countries that kind of did nothing, such as Brazil and Mauritius, did have other kind of in-kind benefits in place. Another thing we can have a look at is the horizontal expansion of benefits. And the key headline really is that while there were these increases in coverage in some countries, often, generally that the increase was quite small. And here's a chart which attempts to show that. And really what this chart shows is the percent of the total population, so people of all ages that received some kind of disability benefit before the crisis. And we see it ranges from about 3% down to 0.1% in Kenya. And here we're comparing to the total population rather than, say, to persons with disabilities, only because the methodological issues with how one measures disability in different countries and the discrepancy mean this is a slightly more kind of consistent way to look between countries. But yeah, what we see is, we look at some countries that topped up benefits, Sri Lanka, Peru, and Kenya among the case study countries, but these in fact were some of the countries that had very, very low coverage. So even though the increase was perhaps quite meaningful relative to what existed there before, some almost kind of doubled the coverage, these still remained quite low coverage benefits. And there were many challenges in doing this. Often the process was done through existing waiting lists, although Kenya and Tamil Nadu kind of introduced kind of ad hoc schemes reaching new populations. But really, overall, as I put there, I mean, this really highlights, I think this is one of the key conclusions coming out of the paper is, horizontal expansion of any expansion of coverage of any kind of social protection benefit during a crisis is pretty tough, but it's particularly challenging in terms of registering persons with disabilities who weren't already registered, given the challenges of disability assessment, even in normal times. Okay, so then the kind of final core discussion was really around these mainstream schemes. So far I've mainly talked about disability-specific schemes, disability allowances, disability benefits. What about other kind of non-disability specific schemes? Well, one thing is that many countries expanded other kind of life cycle schemes, old age pensions, child benefits. And often this was actually done alongside disability benefits. So countries like Sri Lanka, Thailand expanded those schemes alongside other life cycle schemes. And often this combined package could have quite an important role in reaching persons with disabilities. So in South Africa, around 2/3 of persons with disabilities before the crisis were receiving at least one social grant, and all of those were topped up. And about 80% lived in a household that received one. And only, I think, a minority of those are actually specifically receiving the disability grant. Many were receiving particularly the old age grant, which reaches many persons with disabilities. So that combination of life cycle schemes could have quite an important role. In terms of more kind of social assistance schemes, those that were previously targeted at poor, low-income households, and that were expanded kind of horizontally using expanded coverage. I mean, one of the challenges here was that often this depended on the use of existing social registries, registries of poor households, often based on proxy means tested methodologies. Now, a challenge here is that in general, those kind of social registries don't have a particularly good record of taking account of the specific circumstances of a person with disabilities. So expanding coverage based on those registries is had its limits, I think, in terms of reaching persons with disabilities. On the other hand, many schemes, such as the Philippines, they use those existing registries, but they kind of reached a limit to how the population that could be reached, and then look to really expand a system, a kind of scheme that reached the majority of households in the country, which included specific reference to persons with disabilities. The issue there is that this kind of ad hoc expansion, trying to identify persons with disability in the time of crisis, that was often pushed to kind of local authorities, became quite discretionary. It wasn't a consistent process, and there appear to have been quite a number of issues there. Another kind of interesting case to mention is schemes for informal workers. Now, in principle, given the person with disabilities in employment are more likely to be in informal employment, these have the potential to be very, very relevant. And we see some indications in a few countries that persons with disabilities were reached. I think Thailand is one of the countries with the better data on this. And you can see the in the chart here to the right, which shows about, in total, about 700,000 persons with disabilities will access the schemes for informal workers and farmers that were enrolled. However, they still remained a small share of the total people benefiting from those schemes. And there's still quite, while those schemes were put in place in a number of countries, the evidence on them being really adapted to persons with disabilities appears to be quite limited. Final point, around these mainstream schemes is also many of these were channeled through kind of household benefits. And even where these may have reached households with persons with disabilities, they may not have, persons with disabilities may not have been the direct recipients, which again raises the kind of a question around household benefits, the extent to which persons with disabilities have control over that income and have the decision-making role that they have, which is quite distinct to schemes which are directly targeted to them as individuals. Okay, so kind of summarizing some conclusions. I mean, the first is, I think, echoes a broad conclusion of the coming out of the discussion on the kind of social protection response to COVID-19. Having strong systems in place meant that countries were in better position to provide support. Though somehow I feel that that's particularly relevant in terms of disability, given that undertaking the registration of persons with disability it brings with it a kind of additional challenges. And as a result of this, I think that these lessons point to the strong case to expand kind of universal kind of high coverage disability benefits as kind of long-term programs. I mentioned the issues of adequacy both before and during the crisis, and I think again this points to the issue to have a more sophisticated understanding of the different kind of costs that social protection, disability-specific social protection schemes are trying to address. Yeah, and it's again kind of echoes the first point, but low coverage of pre-existing schemes was very difficult to overcome in the time of crisis. The horizontal expansion we see was pretty limited. And again, this highlights I think really the case for building stronger disability registries that can be used as a basis to expand coverage during crisis, even if not everyone in that registry is receiving social protection benefits in kind of normal times, that can be used as a platform to expand coverage. And then the final point is really about the kind of the mixed or limited role of mainstream programs. And just a final few points. I mean, I think a positive thing is we're seeing signs that in a number of countries, the experience of the crisis is kind of motivating governments or spurring them to deal with some of the issues of their long-term systems. There's a few examples there of Tamil Nadu implementing some long-delayed reforms, Thailand increasing the benefit level. You also see that in Uzbekistan. And that awareness of the need to develop disability registries. Another observation is that actually, which we didn't discuss so much, is that many countries put in place multiple measures or kind of adapted their measures over time. It's kind of a similar point to the previous one. And the final point, which I think hopefully will be a good segue to the discussion that Amber's going to lead, is really that I think this crisis has seen a kind of growing engagement of organisations of persons with disability, both in terms of the actual delivery of different forms of support during the crisis, which has been really critical, not least given the limits of what social protection systems have been able to do, but also that there's a growing debate, I think, amongst organisations of persons with disability on the role of social protection. So I think that is all from my side for now. But I mean, maybe just a final note is that, as I noted, this is based on a synthesis paper. It's in the kind of final processes of development and should be released in the coming weeks. But any comments or reflections and questions that come back would be quite valuable, I think, to testing some of the kind of thoughts and hypotheses that we'll have in the final paper.
That's great, Charles. Thanks for that synthesis of some of the COVID-19 response measures that we've seen put in place over this sort of last 18 months. It's great to see that there have been some great responses happening, but there's still a lot of variation, and interesting to hear that some of the mainstream programs are still not really addressing the needs of persons with a disability. I'm sure that you'll get lots of comments on your report from the audience. That was really interesting. Thanks, Charles. We'll move on to our second speaker now. We'll have Amber from IDA speaking to us. Thanks, Amber.
Thank you. Is my voice clear? Okay. My thanks to the organizers for putting together this event and giving us the opportunity to collectively consider what has been done with regard to disability inclusive social protection and ensuring that the receptiveness of social protection systems to persons with disabilities. I'm here to speak about our experiences at the International Disability Alliance around participation and capacity building for persons with disabilities on this particular issue. One of the tremendous reality checks that the COVID-19 era has given us, it's not post-COVID, I'm in India, so it's definitely not post-COVID for us, is the reality of social protection systems in many contexts and the coverage that they have and who gets left behind. On behalf of IDA, I would like to emphasize that any revamp or introduction of social protection systems towards ensuring the inclusion of persons with disabilities and representation needs to be, must involve the full and effective participation of persons with disabilities and their organizations, including the representation of the diversity of the disability movement. So this includes impairment groups, including those who remain underrepresented within the disability movement, but also looking at gender, looking at urban and rural experiences, other intersectional identities and experiences that could lead to multiple and distinct forms of marginalization. My assertion and my request comes with an uncomfortable truth that many of us in the DPO movement have a very complex relationship with social protection. Many of us in the Global South come from contexts where social protection for persons with disabilities, even where it exists, is understood as cash transfers which are stuck in this entanglement of gatekeeping and bureaucracy. When we talk about advocacy that DPOs want to do, it's really around substantive rights like education or access to justice or legal capacity. And social protection in Article 28 tends not to be a priority. For most of us, you know, I can speak personally that there was often this very wrong perception that this is an extension of the erstwhile charity approach, and sometimes it's not something that we want to be seen pushing to policymakers. But capacity building around strengthening engagement on social protection therefore took a lot of learning, but it took an equal amount of unlearning for many of us depending on our national context. The COVID-19 situation continues to show us the potential of social protection to protect against shocks and emerging risks that we face in society, particularly when we are persons with disabilities. When we learn from our peers about the examples of countries where this was put into action, and Charles mentioned a few of them, that became aspirational for those of us who did not have such practices. And so the natural progression really was, what would social protection look like if it was disability inclusive? At IDA, with the support of our regional members like the ASEAN Disability Forum, the African Disability Forum, and our partner TCI Asia Pacific, along with the UNPRPD project, we organized discussions with OPDs in Southeast Asia, South Asia, and Africa in English and in French to discuss what were social protection coverages looking like and what were the programs for persons with disabilities during this COVID-19 time. A lot of the discussions were, as Charles pointed out, the role of OPDs or DPOs in identifying people with disabilities and often taking on the role of the state by ensuring that people had access to relief measures, for example. These discussions led to multiple outcomes. So with respect to South Asia, a report was published, and I have just dropped the link in the chat, on social protection response to COVID-19 for persons with disabilities, looking at both available data and the experiences of persons with disabilities regarding access. In Africa, the work and the DPO experiences fed into the Policy Dialogue Conference on Social Protection in Africa, organized by Bridging the Gap, together with IDA, the Africa Disability Forum, and the ILO-UNICEF-UNPRPD Social Protection Project. The call for action on disability-inclusive social protection was one of the outcomes of this. This was a momentous event and followed 2 online sessions, a technical seminar and a political conference. In parallel to this, the Bonn-Rhein-Sieg University, based in Germany, offered 2 sessions of a short online course on social protection and inclusion of persons with disabilities in cooperation with ILO and UNPRPD, UNICEF Norway, and the Center for Inclusive Policy. This was free of charge for applicants who were selected, and 1/3 of these applicants were from organizations of persons with disabilities. And among the applicants who were selected, there were many who were from underrepresented groups of persons with disabilities. This was a great opportunity to learn and unlearn, as I said, and we got to work together with peers from social protection backgrounds, which created a great space for mutual learning. We reflected together on extra costs incurred by persons with disabilities because of the inaccessibility of the environment and the importance of social protection for realization of inclusive education, deinstitutionalization, and being able to live in the community, inclusive healthcare, as well as the realities of certification and means testing in our own context. The next step was to take this learning forward to the grassroots. And I'm really happy that some of the participants today are from Uganda, because that was where the first IDA course on social protection, disability inclusive social protection, was piloted. Those who completed the course at the Bonn-Rhein-Sieg University, from OPD representatives who were part of the IDA community of practice, worked together to develop a short in-person course on disability inclusive social protection. This effort was led by my colleague, Al-Radi Abdullah. This was piloted in Uganda, and it was followed by a session in Kenya just last week. It's a 3-day workshop. We see the impact of engagement quite strongly. When the university opened its course again this academic year, the response from Africa, especially from Uganda, was astounding in terms of people who wanted to be a part of this course. The community of practice has also been providing technical assistance on several documents relating to disability inclusive social protection. Social protection as a means to full and effective participation beyond cash transfers is now emerging as an informed demand of the OPD sector, who now have answers to the how as well as the why of this. I reiterate again the importance of involving the lived experiences of persons with disabilities into discussions around disability inclusive protection, social protection, as well as the identification and understanding of what disability extra costs look like. The costs that people with disabilities and their families incur towards their full and effective participation in society are not things that can be speculated on. Data has been one of the barriers to achieving meaningful inclusion in several aspects, and it is so important to learn from persons with disabilities on how social protection can be more meaningful to their realities. I draw your attention to initiatives to support participation of all persons with disabilities in consultations and discussions, including inclusive facilitation practices that are used by IDA at the Bridge CRPD SDGs training, as well as other capacity building initiatives, but also complemented by focused initiatives for persons with intellectual and learning disabilities, such as Listen, Include, and Respect, which has been developed by Inclusion International and Down Syndrome International. The enthusiasm and capacity of organizations of persons with disabilities to participate needs to be taken note of by stakeholders working on social protection. There really can be nothing about us without us, and the transformative potential of social protection will be lost without the meaningful consultation and involvement of organizations of all persons with disabilities. Thank you very much.
Many thanks for that, Amber. We might have a quick question and answer session now. We've got a few questions in the question and answer box. So why don't we go to those and then we'll move over to Alex's presentation. I'll just get those up. So the first question is for Charles. Charles, we have a question here. Are there any available data about the level of participation of people with disabilities in the design, planning and implementation of the social protection programs that were put in place or scaled up during the COVID-19 pandemic?
Yeah, should I go for that? I mean, yeah, there is I mean, I think it's something that Amber's already reflected on a little bit and shared some kind of insights. I mean, there is a specific report that has also been developed on that issue, which is going to be published soon. I mean, generally, I think it's been yeah, the impression one gets from the case studies is quite mixed, quite limited in most cases. Though in others, there's been a little bit more. Yeah, that may be something that in Alex's next presentation he'll reflect on a bit as well.
Yeah, great.
If I can add to that, so I'm just it's one of the, I think that there's a lot of efforts to try and see what participation has been looking like for organizations, and in many cases whether that participation has been effective or not is something that we need to see. I've just dropped a link in the chat to the second IDA Global Survey on participation of organizations of persons with disabilities in policies and programs. I would encourage organizations of persons with disabilities who have joined this conversation to please be a part of the survey. It would take not too much of your time, but I think it's one of the efforts towards understanding the kind of participation that OPDs have been experiencing, including on social protection programs. So thank you.
Oh, that's great. Thanks, Amber. I'll make sure that that survey link gets shared around after the webinar too, so that you can get some responses also from our region here in the Indo-Pacific region. We don't have any more questions at this point. Oh wait, here's one's just popped up. This is from Idul. Hi, are there any available guidelines to support the development of disability inclusion social protection? I might throw this one to all of you. Have some guides that you can put up in the chat box, perhaps.
Actually, I think this is a very good segue to the next presentation, because those are some of the issues I would like to cover more specifically. Yeah.
Yes, great. Well, let's go for that, Alex. And why don't you start your presentation now? That sounds great. Thanks, Alex.
Thank you very much, Felicity, and thanks a lot, Charles and Amber, for those first presentation. So what we will do now, and it responds to some of the questions that we had in the chat box, is trying to see what is actually happening, trying to tackle those key issues that have been highlighted by Charles and Amber. So I think we have clearly identified the issue of collaboration and engagement with organization of persons with disabilities being a critical step to build inclusive and shock responsive social protection systems. One element that is very important is the issue of prioritization, and we'll come back to that a bit later. Countries can't do everything tomorrow, so they will need to prioritize. Do we start with the cash transfer? Do we start with the services? Do we start with children with disabilities, with older person, etc.? And the engagement of organization of persons with disabilities and really building a consensus with the diversity of persons with disabilities, I think is really critical. I won't go too much into this because I think Amba covered it extensively, but this is definitely something that is critical. What we saw in the COVID-19 crisis is a mixed aspect. Some of the colleagues said that actually for them, having an online Zoom meeting made their participation in discussion with government on social protection easier because they didn't have all the barriers in getting to the meetings and inaccessibility and the cost, etc. But most of the colleagues were telling us that they didn't have a chance actually to influence what was going on, except the many cases where government reached out to DPOs to help for outreach and identification of persons with disabilities for response. That was mentioned by Charles. Another issue that is really important, awareness raising and capacity building of stakeholders. As Amba said, many people in the disability rights community are not really aware on social protection, and many people on the social protection community are not really aware of disability inclusion requirements. So we've done some work. The training with the Bonn University that Amba was mentioning is one of them. The series of webinar is one of them. And to answer the question, several organizations are now working on guidance around inclusive social protection. I will share with you some elements here. But we will post to the community in the coming weeks and months different background papers and guidance documents that are getting produced by ILO and UNICEF, but also GIZ and the World Bank. So there is really a momentum with different agencies moving forward with regards to guidance for better inclusion of persons with disabilities in social protection. Another element which is important, which we will not tackle in detail today, is really working on accessibility of delivery mechanisms. I think the COVID-19 crisis really showed the lack of sign language interpretation, the inaccessibility of written information or websites, which is true for public health program or messaging around COVID-19, but it was equally true for informing persons with disabilities about the response package and the type of benefits they could access during the crisis, and it's still happening. We have seen many countries trying at the beginning for many weeks having sign language interpretation in TV when they were talking about public health messaging, but it kind of phased out, and few remain, but we can see, and the big issue is there is not enough sign language interpreters, and there are no systems in place to ensure sustainability of such accessibility of information and communication. So those are elements also. We will come back to that later this year, and we have guidance getting prepared on these elements. What I would like to tackle more specifically today is the issue of disability inclusive social protection information system and the connection with disability assessment and registries, the whole issue of recognition, assessment and addressing disability-related costs, and the progressive development of a combination of in-kind and in-cash transfers that would allow greater support for persons with disabilities and avoid some of the shortfall we have seen during the COVID-19 crisis. So looking at disability inclusive information system, especially on social protection, I refer to the paper that has been written by the Space Help Desk, which is financed by the UK, Germany, and Australia. And we collaborated with this help desk to produce this paper on inclusive information system for social protection with a specific attention to gender and disability. And you will find in this document the best, I would say, available practices, or at least example of interesting practices. And it combined two elements. The first one is a recognition that identifying person with disability in the middle of a major crisis like COVID-19, especially carrying out reliable disability assessment, is very difficult. Charles mentioned it. So it's very important to have social protection registries that already include questions about disability so that we can identify households with persons with disabilities. This has been, for instance, very useful for Dominican Republic. They included in 2018 question on disability in their survey for building social registries. And during COVID-19, with UNICEF support, they have been able to actually target households of children with disabilities to provide them with specific cash transfer. They would not have been able to do that if the social registry didn't have questions on disability. But beyond this social registry, we definitely need disability-specific registry. And I think that the question is really not one or another, it's definitely one and another, and how do they connect together? I think Charles said today, it's difficult financially to provide universal coverage very fast on universal disability allowance, but countries can have comprehensive and universal disability registry, which would allow them to provide additional support to persons with disability who may not benefit from cash transfer, but could require them during a crisis or benefit from an extra support during crisis. What is really important there is for disability assessment to move beyond this narrow eligibility determination. I will assess disability for you to get the disability allowance. It's trying to broaden that, and we will come back to this. So it requires investment in comprehensive national disability registry. And when you do those registry, to make sure that they will be able to collaborate and connect with other registries. So that will help coordination across sectors, but also between central and local government. We saw, for instance, in Indonesia, how important local government were in providing support to persons with disabilities because they know who they are better than the national system at this given point of time. And those disability registries can be a critical source of data, of administrative data for design and monitoring of social protection schemes. So I will pass on that, but one very important element, we had question on tools. Do we have tools to assess disability? And yes, there are tools, but the key question is that you cannot take a tool out of the shelf and apply it in your country just like this. Each country needs to solve an equation, which is we need a disability assessment mechanism that is available everywhere in the country, easily accessible for all persons with disability and free of charge. This is really a very strong recommendation of the CRPD committee. But in the same time, we need a comprehensive disability assessment that doesn't look just at the impairment, but look at the support needs of the person and the barrier they face. And this needs to be true for all persons with disabilities, not only people with physical disability, but also people with sensory impairment, intellectual disability, or psychosocial disabilities. And we need tools and approach that are different for children with disability, especially young children and adults. You don't assess disability the same way for children and adults, and you need different tools. The problem we've seen is when countries try to do this more comprehensive assessment, they tend to make it more complicated. And if it's more complicated, then you need more specialized staff, which you don't have everywhere in the country. So trying to solve one aspect of the equation prevents you to solve the other aspect of the equation, which is the easy access everywhere in the country. The challenge also is that for ministries to use this disability assessment and the disability status that will come out of it, it needs to be reliable. Different ministries need to be sure that this is a system that prevents fraud, but also for persons with disabilities that is transparent enough so that they trust the results. of the assessment and the determination of disability. It needs to be accountable with good and responsive grievance mechanism. Participatory organization of persons with disabilities need to be involved in the design of this disability assessment mechanism, and it needs to be connected with other information system and registries. And today, it's impossible to say, take this tool and that will solve all those problems in your country. What you need to do is really to look at what are the challenges today in your country with regards to disability assessment. Is it a problem of comprehensiveness? Is it a problem of accessibility? Is it a problem of reliability, or three of them? Then trying to figure out what is the service. Is it the social welfare office? Is it the healthcare, primary healthcare system? What is the service that has the best infrastructure in the country? Or maybe a mix of those, to ensure that you will be able to do this assessment everywhere, in the cities and in rural areas, in the mountain and on the coast. And what are the human resources that you can use to do that? If you will need to do that at local level, you will use community workers, social workers, primary healthcare workers, DPO staff, a mix of those. And what are their level? What kind of skills do they have? Then you have to think about the mechanism you have to use to achieve quality control. And once you have asked yourself all those questions and find answer for all those questions, then you can say, okay, what are the tools that we can use to build our system so that those people in those services at local level can do a good quality disability assessment. And very often the problem is we start with the tool and then we think, okay, how do we train the people to use the tool? Rather than building the tool with the people that will use it in mind. And that's really a very important thing. So many countries have, not many, actually few countries have gone in that direction. For instance, Fiji or Cambodia. And I wanted to highlight Cambodia because it's really a kind of groundbreaking initiative. Cambodia developed a very kind of simple yet fairly comprehensive disability assessment tool several years ago and worked on several iterations. And when they felt confident that was comprehensive enough, but also adapted to their local capacity, they developed an app. And local workers are using smartphone and carrying out assessment in the community with persons with disabilities. And the information, they collect information on the impairment, on some needs of assistance, as well as some level of need with regards to assistive device. It's not very complex. It doesn't cover everything, but it's the balance they found adapted for their context. And then they transfer data from the smartphone to the district level, which cross-check and clean a little bit the data, potentially ask further questions to the local community worker, and then it gets at the national level for approval. This could be done only at the province level. They chose to go to the national level. It's one way of doing it. But the interesting thing is that it provides greater reliability while increasing accessibility and comprehensiveness. And in the same time that they do the assessment, they build the National Disability Registry. So this is the beginning. They are 2 years in the rollout, but one first benefit that they had is they could use the disability registry they are building, for instance, to support the rollout of vaccination against COVID for persons with disabilities. So we can see immediately the benefit of having an electronic disability registry that would really be used not only for cash transfer, but for case management and shock responsive emergency support. Another issue beyond disability assessment that we talked about is disability cost. And it's very important, the first, that social protection systems in their policies, in legislation, recognize the importance of disability related costs and its impact on poverty and marginalization. And that's not only poor people that have disability-related costs. People with disability that live in non-poor families often have disability-related costs that they cannot afford. I'm talking about assistive device, surgery, support needs like interpretation, etc., which means that they are very isolated, even if their family is not considered as poor. So that's very important. How do we assess disability costs? Fortunately, in the last year and a half, there has been an increasing number of studies, and by the end of the year, we will have more data, quality data, with research being carried out in Bangladesh, Kenya, Indonesia, Georgia, Philippines, and more are coming. There is also a work on methodological consensus between academics and social protection practitioners that are working on disability costs, trying to establish a kind of baseline or consensus on methodology so that all actors are actually referring to the same methodological framework to measure disability costs. What we need to do after that, and we are starting to invest in this, is, okay, we know the disability cost, we have numbers and extent of disability cost. Now, what is the impact on poverty measurements? And what does it mean in terms of access to health, education, and employment? So basically, how do we address those disability costs? Adapting targeting mechanism and means test, like it has been done in Mongolia or Moldova, increasing the social assistance benefit value, like in Zambia, but most importantly, developing a context-relevant combination of in-cash and in-kind support. So we know, and Charles referred to it, one disability allowance will not solve the problem of income security, coverage of healthcare costs, and disability costs. It's impossible. You need a diversity of scheme because you have a diversity of person with disabilities, children, adults, older person, people who have a high level of support needs, lower level of support needs, etc., etc. So when we talk about cash transfer, one of the things that we see emerging in systems, it's really the hybrid disability allowance. In high-income countries, you often have two benefits for persons with disabilities. One for people who have difficulty to earn income, so that's kind of basic income security, but also another benefit that covers disability-related costs for all people with disabilities, whether they work or not. In low and middle-income countries, you often have one disability benefit, which is usually poverty-targeted or linked to incapacity to work, or both. And that makes it more difficult for persons with disability to participate in economic inclusion, but also it excludes a lot of people from support. So it is important to make this one benefit, when you can have only one disability benefit, to make it compatible with work, because it supports socioeconomic inclusion, but also compatible with other income security benefits. In many countries, there is this element of, we want to avoid double dipping. If you get old age pension, you cannot get disability allowance. What about older person with disabilities that have extra cost on disability? Their old age pension is for the rice and the roof over the head. It's not for disability cost. So for instance, Thailand is making those benefits compatible. The issue is those benefits are very low. So we have to take that into consideration. It's also very important when there is means test for poverty assistance for household, that the disability benefit that one member of the family might receive is not taken into account when you make the means test and you assess the income. Why? Because otherwise you reduce the positive impact of this disability benefit on coverage of disability extra costs. And we have seen also that having this broad coverage of disability-related costs that are not poverty-targeted and disability benefit that are not poverty-targeted can have a positive impact in terms of crisis response, because it cuts across income group, and it can support, when you do top-up, for instance, it can support families that are not considered poor, but are not protected by any social protection mechanism, which have been some of the most impacted during the COVID-19 crisis. Other element that were mentioned by Charles, the healthcare aspect, which is a significant source of extra cost. Assistive device, one-off payment that many persons with disability cannot afford, but also human assistance that is really important and expensive. We talk about interpretation of personal assistance, and definitely here, a single disability allowance will not address those costs. So when we talk about universal health coverage, it's extremely important, one, to prioritize children and adults with disability in expansion. If you choose group, for instance, poor people should get free healthcare, immediately include all children and adults with disabilities because they have more healthcare costs, direct and indirect, than the rest of the population. And those healthcare costs are more likely to drive them into poverty. So prioritize person with disability in UHC policy. But in the same time, you need also to include rehabilitation and assistive device in universal health coverage package, like it's the case in the Philippines or in Maldives. And many health insurance schemes are reluctant to include too many assistive devices because who will pay for it, how it's sustainable. So many countries are actually making a mix. There is part of the assistive device that are covered by the healthcare system, and part of the assistive device that are covered by the Ministry of Social Affairs with specific schemes. Ideally, you would have more and more assistive device covered under the universal health coverage so that everybody can access them, not only people who have the disability card, but for most expensive and rare assistive devices that usually are used by people that would be identified by the disability assessment system, that could be a co-financing mechanism between health and social affairs. The one thing where we have very little example, and there is really a need for innovation and investment, are community support services. I'm talking about personal assistance, respite care, interpreters. Their absence in low and middle income countries leads to isolation and marginalization of persons with disabilities. That's been very clear during COVID-19. It contributes to impoverishment of households because family members have to stop working to provide care and support, especially women and girls who miss out on education and work opportunities, and it can lead also to their burnout because of the burden of care. And because of all those situations, when families are burnt out and get tired, it can lead to neglect and abuse and institutionalization of persons with disabilities. So, and that's true across the world. So it's really important to develop community support services. Very few low and middle income countries have started to develop personal assistance schemes or caregiver third-person support allowances like South Africa, Vietnam, Cook Islands. Usually amounts are low. It's given to the family members. Sometimes the person with disability has no say. So we need to find ways to enable families and communities to support persons with disabilities while fostering their choice and control over the support in line with Article 19 of the CRPD, but also taking into account the gendered risk and issues related to care and support. And this is a tension. And today we have very few countries that have invested and work on that. And this is a top priority for UNICEF among others, among other agencies. So what we've seen is different countries are at different starting points. Some of them have already disability allowance. Some of them are starting with healthcare support or assistive devices. So what we want is a comprehensive system for children and adults with disabilities, but each country will start from a different point. And all stakeholders that we are today in this webinar, we need to analyze the situation and say, okay, what is the next step for my country? How do we organize the dialogue between states, DPOs, and development agency to basically build this roadmap based on the learning of this COVID-19 crisis to build responsive social protection systems. Thank you very much.
Thanks for that, Alex. That was amazing, and there was so much information in there that we're all going to have to watch your presentation 5 times over so that we can take it all in. That was a great presentation. Thank you. We're on to our final speaker for tonight. So I would like to introduce Quinn, please. Quinn, if you'd like to take over and do your presentation, that would be great. And then at the end of Quinn's presentation, we'll do another question and answer session. Thanks, Quinn.
Thank you, Felicity. Thanks very much. And thank you for inviting the ILO to this discussion. And thank you, Alex, Charles, and Amber for very rich discussions and presentations. I will keep my presentation short, as I also want to leave some time for the Q&A. Yeah, so in addition to the technical work presented by Charles and Alex in the context of the ILO-UNICEF collaboration in the UNPRPD finance program, I wanted to share with you some perspective on what is currently happening at global level. And in particular, I wanted to share with you the outcomes of the second recurrent discussion on social protection that was just held by the ILO at the 109th session of the International Labour Conference in June this year. The conference, and that means tripartite delegations of ILO's 187 member states, this year adopted a very strong set of conclusions to guide countries and development partners in their work of strengthening social protection systems. And as you can see on the slide, in paragraph 12E, the conference highlights relevant action for persons with disabilities. It's a very short paragraph, but extremely important because it builds on the Social Protection Floor's recommendation 202 and elaborates a bit more in detail on some of the key pillars of disability inclusive social protection systems, touching on a few issues that were already mentioned by Alex before. As you can see, the paragraph is also fully in line with the approach that is lined out in the CRPD and the joint statement. So first of all, what is highlighted is the importance of a twin track approach, meaning the importance of both ensuring inclusive mainstream programs for persons with disabilities, but also disability-specific social protection programs that really cater towards the individual needs of persons with disabilities. Secondly, the paragraph outlines the importance of a comprehensive package of provisions needed, ranging from healthcare to rehabilitation, cash benefits, and home and community-based services. And finally, as you can see, the importance of self-determination is highlighted. And of course, I mean, the latter requires having interests represented through organizations of persons with disabilities, an issue which has been highlighted by all 3 panelists before me. So what we see at global level is that, I mean, there's a momentum in pushing for more inclusive social protection systems. And this normative framework really lays a strong foundation for this continued joint work on building and strengthening disability inclusive social protection systems. And also, of course, incorporating some of the lessons learned from the COVID-19 crisis. I mean, we've heard from Amber how OPDs are increasingly interested in social protection. Charles mentioned that there are some signs that some COVID-19 responses are contributing to improvement in long-term systems. And amongst UN agencies and development partners, we have kind of started an informal working group with agencies that are working on disability inclusive social protection. And we're currently looking to exchange on some of the key issues that were already elaborated by Alex before, including measuring and addressing disability-related costs, but also, of course, the issue of disability assessment and determination in connection with registries and information systems, the issue of support services, but also links with care more broadly and links with gender. And also, of course, kind of moving away from the incapacity to work paradigm. And on some of these issues, we're ILO in collaboration with UNICEF and IDA. We're currently finalizing a few background papers, and we would very much like to use these papers to engage with all of you in substantive discussions over the next few months. So yeah, with that, I'm giving back to Felicity and really looking forward to collaborating with you on this in the future.
That's great, Quinn. Thank you. It's great to see these really big sort of declarations happening at the global level on this issue. So it's a pretty exciting time. There's a lot of momentum happening at the moment. We might have a quick question and answer session. Just quickly for Deepa, I'll answer your question. So we will put the presentations from tonight's webinar up on the socialprotection.org website in about 2 weeks' time. We just need to refine the captions before it goes up, but you will be able to access it through YouTube, and all the other webinars that we have hosted in the past will be up there too. So you'll be able to see those in about 2 weeks' time. So we've got a question here for Alex from Mukesh. So what specific value add, oh, I think you just answered it.
I didn't answer this one. I answered the previous one.
Okay, it just popped off my screen. I'll just have to find it again.
So the question was about the value added of disability-specific registries versus general social protection registries with question on disability. And here, it's really about the level of information that you get in the registry. When we are talking with the colleagues that are working on general social protection registry of social registry, they don't have much space. It's a bit like the same debate we have with, including disability question in census or household surveys. So what they want is basically, how do I identify a person with disabilities? But if you do a disability registry based on a comprehensive disability assessment that go beyond medical models, you want to know about impairment of persons, but mostly functional difficulties. What are the support needs? What are the support people receive? What are the barriers they face? Because as a social protection system, you need to know who will need a cash transfer, who will need a personal assistant, who will need an assistive device, who is facing strong barrier in transportation, which means they will need even more support. Those information cannot be all included in the general social registry. That's not possible. So the idea is really to have the social registry or the social protection registry, and then to have the disability registry plugged in. But the disability registry will have much more information. Where I would question this indeed is in countries where the only information that is collected in disability registry is, do you have a disability? Yes, no. Do you have an impairment? Yes, no. If it is the only thing that the disability registry collects, then indeed one might wonder. But the CRPD committee and the work we have done on social protection really show that you need to know much more. If you don't know much more, you will not be able to provide the support that people need. You won't even be able to plan and budget the development of services and benefits that you will be able to deliver in 5 years from now. So that's really the key difference, is the amount of information. Another key difference is that social registry, sometimes, they are poverty targeted, they don't cover the whole population. Disability registry do not look at the level of income of a person. It's just about disability. And that's also a significant difference. I hope that answered the question.
That was great. Thanks, Alex. I'll just have a quick look and see if we have any more questions, but we are running out of time. We do have one here from Ronald, and this is to you again, Alex, but please chime in, anyone else. How can the private sector collaborate with UNICEF in the development of professional support services in lower middle income countries? Are there opportunities for partnerships? I would like you to check our initial steps at, and the website here is http://DASUNS.org. You can see that in the chat bar too. But any ideas on collaboration, Alex?
Thank you very much, Ronald, for this question. Indeed, at country level, I'm not in position to answer to this question because UNICEF is very decentralized. But it is very important that organizations that have this kind of programs approach UNICEF or other donors or development agencies, as well as the government, to really foster this innovation and this investment in innovation. Today, at global level, we would have difficulty to develop a guidance on how do we build community support services for living independently in the community in low and middle income countries. So there is not enough evidence, there is not enough practice for government to say, okay, I will invest in that, I will build this. This is the way I can collaborate with NGOs or BPOs to provide those services. So we really need to expand those collaborations. If you look at high-income country, most specific services, community support services for persons with disabilities, are actually delivered by civil society, financed by or co-financed by government. And this is the model that is prevalent for very good reason. Public sector is usually not in the best place to develop those very responsive, very individualized services. Very few countries do it in high income. So the role of civil society will be critical in the development of those support services. But as I said, I can't really give a straight answer with regards to a specific country. But globally, we are starting this conversation with organizations of persons with disabilities, primarily IDA and its members, as well as organizations like CBM, Humanity and Inclusion, and others. And I will gladly check your website as well. Thank you.
Great. Thanks, Alex. I think we've covered off on all the questions that were in the Q&A. I have put my email address, though, in the chat box. So if you do have any other questions that you would like me to go back to the panelists on, please email me and I will chase them up for you. And yep, so we can follow up any other unanswered questions that might pop up on the chat bar while I wind up for tonight. So I also invite you all to answer the post-webinar survey. There'll be a link in the chat screen shortly, and it's really great if you can provide your feedback. That can help us improve our webinars and inspire topics for the next ones. So the next webinar that socialprotection.org will host will take place on Thursday, the 15th of July at 8 AM GMT time, and it will cover South-South and triangular cooperation in advancing child and adolescent mental health in the context of COVID-19. You can register through the link that will also come up on your chat bar now, but remember to sign up to the socialprotection.org newsletter so that you can be in the know about all the webinars that are coming up. There's always some really great exchanges on the website and lots of resources that you can access there too. I'd like to thank you all so much for joining us tonight. We hope you got a lot out of the webinar tonight. I know I certainly did. We will be hosting 2 more disability inclusion webinars over the next couple of months. So keep your eyes out for information about those. And as I said before, sign up to the socialprotection.org newsletter so you can be on the loop on when those are organised. We will also be having another webinar on the 22nd of July, which will cover off on the gaps and barriers that SOGS communities have to accessing social protection in the Indo-Pacific region. So make sure you join in for that one too. I'd like to thank our sign language interpreters and our captionists tonight. It's a big job for them to concentrate for this long. So a very big thank you to them for all their hard work. And thanks to our wonderful speakers tonight. It was a really rich discussion, and and thank you so much for being here tonight. See you all again soon. Good night.
Thank you.
Thanks, everyone.
Thanks.
Thank you.